Today, in the United States, 37.3 million people have diabetes, and an additional 96 million people, 18 years of age or older, have been diagnosed with prediabetes. Together, these shocking statistics represent almost half of our population. So with numbers this high, the need for diabetes education and support is more urgent than ever, not just as a means of managing the disease, but also as a strategy to prevent it. In this episode, we sit down with Wendy Amaro, Community Memorial's Manager of Population Health, to learn what makes Community Memorial's diabetes education program so unique, effective, and valuable to the community. This is Wise and Well, presented by Community Memorial Healthcare. I'm Caitlin White. Now, Wendy, to kick off our conversation today, I'd love to ask, what is a diabetes care and education specialist?
Well, a diabetes care and education specialist, or CDCES, includes a variety of health disciplines such as nurses, dietitians, physicians, pharmacists, podiatrists, optometrists, as well as others. These health professionals have a core body of knowledge and skills in the biological and social sciences, communication, counseling, and education, and are experienced in caring for people with diabetes and related conditions. They provide collaborative, comprehensive, and person-centered care and education to people living with diabetes.
I'd love to hear more about your program. What makes it so unique?
Well, our program is unique in many ways. First, we offer one-on-one telehealth appointments as well as in-person visits, which provides flexibility for those who can't drive or have a difficult time arranging transportation. We also offer education in multiple languages. Our program is covered by Medicare, Medi-Cal, and other private payers, which means it is available to most people regardless of their insurance. Also, we really go above and beyond by taking a whole-person approach to diabetes care and education that aims to restore our patients' health. We truly want our patients to not only be able to better manage their diabetes, but to improve their overall well-being and quality of life. Another unique aspect of our program is that not only do we have a CDCES, or Certified Diabetes Care and Education Specialist, as part of our team, we also have an RN who is certified in lifestyle medicine through the ACLM, that's the American College of Lifestyle Medicine. The first recommendation in chronic disease guidelines across the board is lifestyle modification. Making lifestyle changes for diabetes will not only help with reducing insulin resistance and lower A1C, but can also help lower blood pressure, cholesterol levels, weight, and reduce their risk for heart disease.
Wonderful. Well, I know congratulations are also in order on your recent Association of Diabetes Care and Education Specialist accreditation. So tell us, what does this recognition mean to your program and what you offer to the community?
Oh, thank you for that. Yes, this is a big accomplishment for Community Memorial. We are the only accredited outpatient diabetes education program in Ventura County. Accreditation means that our program meets the evidence-based standards for diabetes self-management education, or DSME, and provides a high-quality service. It also makes DSME eligible for reimbursement from Medicare, many private health plans, and Medi-Cal.
Well, thank you for that. And now, Wendy, is diabetes a growing problem in the Ventura area? What are we seeing?
Yes, so diabetes is increasing on a global level, with the global prevalence rising to 700 million people by the year 2045. Now, according to CDC data, in the U.S., 37.3 million people have diabetes. Of those, 28.7 million have been diagnosed, whereas 8.5 million are undiagnosed. So, not only is diabetes a growing problem globally and nationally, it's also becoming more prevalent in Ventura County. According to the most recent data from 2021 on Ventura County's public health website, Health Matters in Ventura County, the prevalence of diabetes amongst adults in the county in 2021 was 11.1%, compared to 7% in 2011. So we do see that it is growing. The United States is also seeing a rise of type 2 in children. According to the CDC, about one-third of American youth are overweight, which is related to the increase of type 2 in children. Additionally, certain groups are at higher risk for developing type 2 diabetes. For example, the prevalence rate of diabetes amongst Latinos in Ventura County is 13.8%. Now, recall the prevalence rate for the county overall is 11.1%. Furthermore, those that are age 65 and over in Ventura County have an even higher prevalence of 23.7%. So keeping in mind the varying prevalence rates and demographic data from census.gov, in which some cities in the county are over 80% Latino compared to 44% Latinos overall for the county, we can see that there is an increased need for diabetes education to various communities within the county based on either ethnicity and or an aging population.
Well, it sounds like getting early intervention can help. Why is this important?
Well, early detection and intervention for diabetes can help with reducing the complications from diabetes. Recall that 8.5 million Americans have diabetes but don't know it yet because they haven't been diagnosed. Further, when a problem with blood sugar is detected, people with diabetes and their provider can take steps to prevent or delay damage to the heart, kidneys, eyes, nerves, blood vessels, and other vital organs. The number one cause of death for people living with diabetes is actually heart disease. Aside from all the complications that could result from uncontrolled diabetes and increased out-of-pocket costs for the patient and years of healthy life lost, there's also the mental and emotional toll that managing diabetes can take on one's well-being. So the earlier you have it detected, the sooner you can start to make some lifestyle modifications and hopefully prevent or at least delay the onset of any of those complications.
Okay. And going back to your program, does it also help people who are currently living with diabetes?
Yes, so DSME is a benefit that is covered for people with a diagnosis of type 1, type 2, or gestational diabetes. So to receive the service, you must have one of these diagnoses and be referred by your provider. The topics covered during these one-on-one sessions include nutrition, monitoring blood sugar, taking diabetes medication as prescribed, and understanding how these medications work, getting physical activity, reducing risks, problem-solving techniques, and healthy coping. Our goal is to meet the person with diabetes where they are in their journey and help them to set individualized goals to better manage their diabetes. The behaviors and skills we discuss are tailored to meet the specific needs given their circumstances.
So what should the first step be for someone worrying about risk for or living with diabetes?
So the first step for someone concerned they may have diabetes is to contact their doctor to get their blood work done, specifically a fasting blood sugar level and a hemoglobin A1C. Early signs of diabetes or having uncontrolled blood sugars are feeling constantly tired, urinating often, excessive thirst, losing weight without trying, having blurry vision, or slow healing wounds. If you're experiencing any of these symptoms, you should make an appointment with your doctor as soon as possible to get the necessary blood work and follow-up. Now, taking steps to reduce insulin resistance can prevent or delay the onset of diabetes, and for those that already have diabetes, it can help prevent or delay developing complications of diabetes. So if you are newly diagnosed with diabetes or have had diabetes for any amount of time and need help controlling your blood sugar levels, ask your provider to refer you to a diabetes educator. A diabetes educator, or CDCES, can provide guidance on adopting a healthier lifestyle, including a healthier diet, increased physical activity, weight management, healthy coping, if you smoke, get you help to quit smoking, and more. If you have Medicare, as well as some other plans, in order to have this visit covered by your insurance, you'll need to go to an accredited DSME provider. And as mentioned earlier, we're the only accredited provider in Ventura County.
Wonderful. Well, Wendy, as we wrap up here, if someone wants more information on your program, how would they find that?
They can visit www.mycmh.org and search diabetes. That's www.mycmh.org. Additionally, if they want to talk to someone, they can call us directly at 805-948-6225. Again, that's 805-948-6225.
Well, thank you so much, Wendy, for your time today and for these resources. You can always find more podcasts and resources online at mycmh.org. And if you found this podcast helpful, please share it on your social channels and check out the full podcast library for topics of interest to you. This is Wise and Well, presented by Community Memorial Health System. I'm Caitlin White. Be well.